Fred Andriaccio is the security manager for Kaleida Health. He's here today to talk a little bit about security and the work that his team is doing during COVID-19. Fred, thanks for joining us today.
Good afternoon, Mike. Thank you.
Let's start out talk a little bit about the daily role of security, before COVID-19. Obviously, it's an important function for the organization to keep employees, patients, and visitors safe. But if you can, talk to us a little bit about the security team and its function across the organization.
Yes, sir. The security team across the entire organization has been tasked with not only keeping the campus itself safe inside and outside, but the employees and the patients and the visitors as well. So we have always been vigilant in the fact that we would patrol the campus, patrol the buildings, and make sure doors were locked, make sure that people were aware of where they had to go when they came into the building, and assist with any problems that may occur within the campus.
The function of security obviously has changed since COVID-19. Tell us a little bit about the role of your team those last few months and how that may have changed.
Yes, sir. The impetus obviously was put on people coming into the facilities and making sure that we were screening people. And of course, the visitation rules became very, very strict based on what the Department of Health wanted us to do. And so we had to make sure that people followed those rules. It was difficult for people. It's a very emotional time for people. They're here for treatment for either themselves or their loved ones. And at the same time, we weren't allowing a lot of people to come in with them and be with them. So it was difficult for us to enforce those rules, and obviously very difficult for people to understand those. So we had to come to a happy medium with people and help them to understand that it was important for all of us, for the employees, the patients, obviously the security officers, their welfare was paramount in terms of being able to take care of the actual people that we were allowing into the hospital.
But we'll get back to visitation in a second, but I want to go back a little bit to March of this year when the first positive case hits in Western New York, and then subsequently here at Kaleida Health. The organization moved into an emergency operations center mode, meaning that there was a command center and there was a specific function around the table for different aspects of the organization: nursing, security, operations, purchasing, communications. The security function there and how that led to changes in visitation obviously is important, but being involved in that command center structure, something you've been involved with your whole career, why is that so important to have that type of function during an emergency or disaster?
It's just extremely important to have structure and to have the function of the command center behind you, and kind of setting up the steps and setting the stage for what we're going to do next, and monitoring what's happening. And one of the unique things about this COVID pandemic was that it changed, it morphed almost daily on us. So as that changed, obviously through the command center, we were able to control our reaction to that and respond accordingly, which really made a big difference in the way we responded as a whole, as a hospital organization as a whole.
So as we went through that, like you said, that daily change in operations and how we're responding to this, the visitation changed almost daily over the course of 60 to 90 days, who could be in the building, who couldn't. But the reason, I think there's an educational component here, the reason when we shut off visitation really was driven by the state to say, we really got to make sure that we're isolating as many people as possible. We're implementing social distancing. So the organization, and like all hospitals, went from having almost open doors when it comes to visitation to shutting down altogether. We're starting to come back. People are having surgery. We're starting to let people have visitors in. If you can, tell us a little bit about that change, why there are limited hours, and security's role or function during that.
So once again, just like in the beginning when we had no visitors, it's still very important to control the visitation and limit the number of visitors. And in that respect, we're no different than a restaurant that has been subject to, say, only a 50% occupancy rule. So we've tried to do the best that we can to allow X number of people in to visit their loved ones and be with their loved ones during surgeries and other treatments, and at the same time limit the number of people, again, as you said, Mike, to limit the exposure both to other patients, to employees and staff within the hospital. Security obviously is right on the front line of that. As people come in, we screen them. We have scanners or screener personnel at the entrances to make sure no one has a fever, to make sure that they answer the right screening questions correctly, and make sure that we're not letting anybody in that could possibly be a potential COVID threat to our patients or employees.
And so, and to reiterate, you're implementing state guidelines. This is not something that Kaleida or locally we've come up with. This is really just implementing State Department of Health guidelines for visitation of patients, correct?
That's correct. And, I emphasize that to people. I've been, as the security manager, I've been called to talk to people about the guidelines and why, and explain to them that, Kaleida is just following a policy that comes from a much greater power, the State Department of Health, and this is their requirement. And if we want to continue to operate and function in a safe and healthy manner, we have to follow those Department of Health policies.
Oftentimes, security is among the first that a patient or visitor, loved one may see when they walk into one of our hospitals. Are people feeling a little more comfortable now? Are they happy to see you? Are they relieved? Do you guys help them in terms of getting through that, that visitation process and screening, identification, things like that?
Yes, I really believe they are. They're happy to see us. I've had many compliments about our officers when they're assisting with the screening process and scanning people in as the people come in, that they're glad we're there. They're glad we're doing what we're doing. They completely understand it. And, that makes all the world of difference to us and to everyone else around us when the people coming in understand it also.
So, Fred, as we wrap up here, any specific message points that you'd want, the general public to know from a visitor standpoint, or people who are coming onto a hospital campus from the security standpoint?
Just probably the most important thing, again, to emphasize that what we talked about earlier, that it's always changing, is to contact the hospital that you're going to, or get on the Kaleida Health website and check for the most up-to-date visitor policies, because they may change. What I tell them today may change tomorrow. Right now, the visitation at Buffalo General is from 3 p.m. to 7 p.m. At Oshai Children's Hospital, it's different than that because there's a children's component there, and we always try to make people available and be there for their children when they're at Oshai Children's Hospital. But the best thing to do is get on the Kaleida Health website, check the visitor policies, or call a hospital if you need to do that, and we can help you out there as well.
That's great information, great tips. Fred, thanks for joining us today on Medically Speaking.
Thank you, Mike. Thanks for having us. We appreciate it.